Hi, I'm Evan Dellon from the Center for Esophageal Diseases and Swallowing at University of North Carolina School of Medicine in Chapel Hill. Today, I'm pleased to demonstrate how to use the I-SEE application to easily assess disease severity in patients with EoE using a real-world case example. The American Gastroenterological Association's Index of Severity for Eosinophilic Esophagitis, or I-SEE, app was developed to give clinicians an easy way to evaluate the severity of eosinophilic esophagitis, or EoE, in routine practice. I-SEE allocates point values to key disease features including symptoms and complications, inflammatory features including endoscopy and histologic features, and fibrostenotic features, again from endoscopy and histology. From these points, the app calculates a score categorizing disease state as mild, moderate, or severe. In this example case, a 48-year-old man with a history of EoE presents to the gastroenterologist with worsening dysphagia occurring several times per day with each meal. As a result, he avoids eating out with his wife and friends. He was recently admitted to the hospital after a food impaction and emergency endoscopy, and esophageal perforation was excluded. Upon follow-up, endoscopy shows he has diffuse edema, exudates, and furrows, prominent rings, and a stricture that is so severe that the regular adult scope could not pass without dilation. His esophageal biopsy reveals 64 EOs per high-power field and lamina propria fibrosis. Let's see what this case looks like when entered into the I-SEE app. First, we select the age group of our 48-year-old patient. Disease features may be weighed differently depending on this metric and patient age. The next screen is symptoms, where we add his worsening dysphagia several times a day and disruption of social activities. This is not a patient-reported outcome, but rather the clinician's conclusion regarding symptom frequency, and can reflect any symptom related to EoE that a patient might have. As you enter each patient detail, you'll see their I-SEE score change in the colored circle in the top right of the screen. You can tap the More Info button at the base of each step's screen for a description of what that disease feature may entail. Next, we can enter this patient's complications, selecting all that apply, which increase his score. Severe features like esophageal perforation or malnutrition, which is commonly seen in younger patients, garner 15 points and automatically categorize a patient's disease as severe. This patient's inflammatory features of edema, exudates, and furrows were diffuse. And for fibrostenotic features, dilation was needed in order for the scope to pass. The patient's histology showed us an eosinophil count of 64 EOs per high-power field. Finally, we can also note that this patient has lamina propria fibrosis. The app has calculated this patient's I-SEE score, classifying his EoE as severe. Once you've calculated an I-SEE severity score, you can tap the Resources button at the bottom of the final screen for an explanation of how the score was calculated. Although the I-SEE score is not yet validated to support specific treatment decisions, you may use this score to help your patients understand their disease progress, or as an indicator that new treatment options could be discussed. Treatment options are growing for patients with EoE. Conversations about patient preferences might include strategies such as diet therapy, proton pump inhibitors, topical steroids, or a biologic. Additionally, budesonide oral suspension and dupilumab are now FDA approved in the US for EoE and can be discussed as treatment options with patients. This makes monitoring disease activity and severity essential to helping our patients understand their disease and when it might be time to make a change. I want to thank the AGA for sponsoring the development of the I-SEE tool. We hope this education helps clinicians to more easily and proactively evaluate disease severity in patients with EoE.